Lymphatic fluid accumulates along the hairline, the forehead and the eyes for the same reason that Newton discovered with the apple that fell on his head, and that is gravity. You take advantage of gravity, and in more cases than one, there will be no swelling after hair transplant. So do you need to worry if you get excessive swelling after hair transplant procedure? If the swelling that has occurred after your recent hair transplant procedure is painless and you do not feel any discomfort, there is nothing to worry absolutely. But if it is red and you have a throbbing pain, hang on and watch this video. But if your swelling has persisted beyond the 7th day after the procedure and you are a diabetic and there is redness, throbbing pain and even fever, please switch off this video, pick up your phone and call your doctor immediately. For in that case, it is an emergency. Because infection in this setting, if not controlled in time, can be devastating. In this video, I will discuss the causes, the prevention, the dangers, and the treatment for the swelling that may appear on your face after a hair transplant procedure. If proper care is taken during the procedure and immediately after the patient follows up with the instructions, it is very rare that you will come across swelling after a procedure, a swelling that descends down the forehead and into the eyes. Swelling happening after the procedure can be shocking, and it can be socially very restrictive. Moreover, patients from out of town or even those who've traveled from out of the country will not be allowed to board the flight back home. With a swollen, sick-looking face and eyes that cannot see, no security is going to clear you to board a flight. However, if you have to extend your stay because of the swelling that occurred and you had not catered for this extra expense, it can cost you quite a bit when you're away from home in a foreign country many times because you have not catered to these additional days of stay in your budget while budgeting a hair transplant. And this is why you often see in places where hair transplants are done in abundance, like in Turkey, the internet is flooded with patients roaming around the streets with tight bands in their upper forehead. This is a mechanical way to control swelling in the post-operative period after hair transplant. But these are not good to use. As far as healing is concerned, this is not the appropriate way to prevent a swelling. The fluid needs to drain out naturally along lymphatic channels, along venous channels for better healing. And the more quickly this happens, the better the healing, the better the recovery, and the better the hair growth. Mild swelling is natural. It will always happen. It is a part of the inflammatory process after any surgical intervention. 5 cardinal signs of healing or inflammation were described by Celsus some 2000 years ago, and they still hold true. And that is rubor, tumor, dolor, calor, and functio laesa. As long as the inflammatory process is limited to healing, there is nothing absolutely to worry about. But if there's no sign of this abating, the inflammatory process goes haywire and you cannot rein it in, worse things can happen. Functio laesa or loss of function happens when disaster strikes, when severe infection sets in. And in hair transplant, this usually happens in the backdrop of uncontrolled diabetes. Like in the case of a Pakistani actor who lost his eye a few years back. The same thing happened a few years back in a clinic in southern India. In both cases, the patients had not been evaluated properly. So what are the causes of increased swelling after a hair transplant? A swelling can occur because a large amount of tumescent fluid was injected into the recipient area to facilitate slit making and plantation. It can also happen due to inadvertent vessel rupture during nerve block, using needles, cross needles for slit making, due to infection that might set in, and not using corticosteroid. Usually swelling that happens in my clinic is quite mild, and it usually subsides by the 5th or the 7th day after the hair transplant procedure. Only once or twice in a year I experience a patient in whom the swelling has descended down into the eyes, obstructing his vision. With proper patient care and follow-up, swelling should never happen. But then there are other clinics where swelling is the norm. Swelling happens in 100% of the patients. This is nothing but poor technique and poor follow-up and poor compliance by the patient. So how does a surgeon prevent swelling from happening? Number one, giving preoperative medications that prevent swelling, avoiding aspirin and ibuprofen immediately before the procedure, proper laboratory investigations to rule out underlying medical conditions, doing a minimally invasive hair transplant procedure, use of triamcinolone during the procedure, proper post-operative instructions which are explained to the patient in the language that he understands, anti-inflammatory drugs that facilitate healing and prevent swelling from occurring. And how does the patient comply with medical instructions and prevent swelling from happening in his case? He should avoid exercise in the immediate post-operative period. Do not talk in an animated fashion. Stay away from office for at least 24 to 36 hours after the procedure. Do not bend forwards for 2 to 3 days after the procedure. Try not to work on your PC or on your phone with your neck bending forwards. Forehead massage to change the direction of flow of the edema fluid from the center to either side towards the temples, but being very careful that you do not tamper with the hairline. The hair graft should not come off. Staying in a hotel, in the peaceful environment of hotel and not with relatives, especially whom you've met after many years, and where you might be socially inclined to engage in conversation immediately after the procedure. 45 degrees elevation as shown in this picture for the first night, and on subsequent nights 30 degrees or 15 degrees elevation with the head supported on 2 or 3 pillows, looking upwards towards the ceiling, not bending to the left or the right, not tossing and turning in bed in the first night, not lying on your face. This elevation helps by preventing venous and lymphatic pressure, and therefore it prevents swelling. This gravity position facilitates the fluid that has accumulated to follow channels along the occipital and parieto-temporal areas. This gravity position facilitates the drainage of the fluid along occipital and temporoparietal channels. Activities of daily living like bending forwards to eat, going to the washroom, tying your shoelaces, these small periods of time when you bend forwards just do not matter. Because it takes at least 1 or 2 days of sustained frequent bending forwards for lymphatic fluid to move from just below the hairline to the center of the forehead and into the eyes. But once edema has set in, once the swelling has begun, steroids, ice packs, mechanical restriction, forehead massage have little or no effect. The horse has bolted. Therefore, prevention of swelling after a hair transplant procedure is most important. But there is so much more that can be done by a doctor and his clinic to prevent swelling in his patients. But that is the subject of another talk. Till then, stay safe and have a happy new year. If you have any further questions about hair loss, hair treatment, and hair transplant, I am there to help you. Just drop a comment in the comment section below and I'll reply back at the soonest. And God bless you.